For this video lecture, we're going to talk about the ethical considerations in doing research. So these are the topics that we will cover for this lecture. We'll talk about the ethical principles from the Belmont Report, and then we'll talk about the elements of research ethics based on the Philippine Health Research Ethics Board National Guidelines for Health and Health-Related Research published in 2017. And then we'll talk about how do we conduct or secure informed consent. And then we'll talk about specific ethical considerations that are found in social research, which is the type of research that you will be doing in this class. And then also ethics in internet and digital research. I added this because since it's pandemic, most of the research will be done via this mode. So before we talk about the different ethical principles, let's talk about first, when do we know that there is an ethical dilemma when we are conducting or planning a research? So an ethical dilemma in research is a situation in which the rights of the study participants are in direct conflict with the requirements of a rigorous study. So this is one of the things that research developers, research planners, and researchers are really facing when they are trying to design the research. Majority of the procedures that we make use of in social research will involve human respondents, subjects, or participants. Whether you are conducting a survey, you are doing an interview, or you are doing participant observation, there are going to be people who you're going to be collecting data from, whether that's primary or secondary data. And therefore, it is important that while we want our research studies to be very rigorous, very reliable, very valid, that we are designing our research so that we'll be able to test the relationships that we want to test between the variables, we also have to make sure that in the process, all the study participants are protected and their rights are being enshrined. So the participants must be free from harm during their participation in the research. They should be treated fairly. They should receive the maximum benefits if there is such a thing in the research that you are doing, and that basically they are not being hurt in the procedures that you are doing in the research. Now, in the health sciences, this is a big issue because you're dealing with health and the existence of people. Because there are certain research in the health field that can cause danger in the life or in the health of the people. In social research, the stakes in relation to the possible harms that research can do to people may not be as high stakes, as clinical trials in health and medical research, but there is still a lot of risks that are found in some research that can be a part of the study that you might be designing in the future. That's why we are having this conversation, we are having this discussion. So when we do research, we can base our decisions in making an ethical research through different codes of ethics. And then the first three are the common ones that all researchers follow, and then professional code of ethics and legal basis are specific to the context of the professional and of course on the context of the country where the research is being done. So we have first the Nuremberg Code. So this is the first universal research ethical principles that we have, and basically it is related to human experimentation, which was created as a result of the Nuremberg trials at the end of the Second World War. So we do know that during the Second World War, there were a lot of very unethical experimentations that were being done. And for that to not happen again, the Nuremberg Code was established. So some of the principles of the Nuremberg Code that we still see in ethical codes today are the voluntary consent of the human participants is absolutely essential when we are inviting them or recruiting them for research, or for instance, the principle that all research should be conducted to avoid all unnecessary physical and mental suffering to the patients or to the participants. Next, we have the Declaration of Helsinki, and the Declaration of Helsinki is established by the World Medical Association, and basically This also follows some of or most of the ethical principles that have been forwarded by the Nuremberg Code, but basically this is related to medical research. And this was also the birth of what we call the ethics review committees. So what are ethics review committees? So ethics review committees are set of people or set of members that are being established within an institution wherein a research is going to be conducted, or the institution where the researchers conducting the research are found. And what they do is that they review the researcher's protocol in doing the research and trying to talk about what are the possible ethical blunders or ethical mistakes that may be done by the protocol, and therefore suggesting whether or not this protocol is good for implementation, or this protocol needs to be modified in order to protect the participants that are going to be recruited for this protocol or for this research. So the practice of having ethics review committees started because of the Declaration of Helsinki, and in the LSU, and in most universities in the Philippines, we are already establishing ethics review committees within schools, so that all the research that are being done by faculty members and also students within these institutions will be checked by these ethics review committees. And the goal of ethics review committees is to be able, like I said, to check on the proposals and the protocols being done by the researchers in order to see whether or not there are any ethical issues or conflict of interests found, so that this can be addressed immediately prior to exposure of the participants to the research, so that lesser ethical issues or no ethical issues will be experienced by the researchers and the subjects when the research is already being implemented. So next we have the Belmont Report. So the Belmont Report was written by the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research, which is a result of the National Research Act of 1976 in the United States. So the major ethical principles that I will be discussing in the body of this lecture will be based on the Belmont Report. And then of course, each discipline or profession will have their own professional code of ethics that needs to also be followed by the researchers doing research in a specific discipline or profession. And also you have to take note of the different legal frameworks that are found in the country where the research is being done, and make sure that it's also compliant with the legal basis. Like for example, the Data Privacy Act is a very important thing, and that is coinciding with research practice, and therefore all of the requisites of the Data Privacy Act must also be followed by the research process that is being designed and implemented. So, under the Belmont Report, there are three principles, or three ethical principles. The first ethical principle is the principle of beneficence. So, beneficence basically means, above all, do no harm. And when we say do no harm, this is most likely or most of the time talking about the participants, respondents, or subjects of your study. So, what is being ensured here, that in the conduct of the research, no participant will be harmed. Now, there are different types of harm. Of course, when you do medical research, for example, you're doing testing for vaccinations or new drugs or nutritional supplements, you have to make sure that this will not cause any physical harm or disease or injury on the participants. And if they do cause these things, it must be kept to a minimal, or the benefits should outweigh the risks. But in social research, what are common sources of harm? So we will have a more detailed explanation of that later, but example of harms are psychological harms, social harms, legal, and economic harm. And we'll talk about them in a while. Next, there should also be freedom from exploitation. So this is something that must be looked at, especially when the participant or the subject of the research is vulnerable. When we say vulnerable, there are characteristics in the participant that make the person more at risk of being harmed or being exploited or coerced by the researcher. So, for example, this is a faculty member doing a research on the students and trying to require them to answer surveys. So that's an example of exploitation. Or for example, the researcher going to impoverished communities doing research about poverty but not really helping them out in relation to their situation, then that's an example of exploitation. So there, that should not be done in the protocol. So when you're creating your protocol, later you make sure that there are no harms and exploitations that are being done in the study, whether it is implied or explicit in your proposals. Next, we have maximizing benefits to participants and society. So this is very important that the research that you should be doing must be for the benefit of the participants. They should be getting some sort of benefit from joining in your study. And of course, this is in relation to the magnitude of the study that you're doing. Syempre, if it's a survey, then you don't expect that much or that big of benefits. But for example, when you're doing interventions like social programs, then you have to make sure that the social programs being tested in the study must be received by the participants. And of course, the research that you should be doing must also be beneficial to the society. So the social value of the research must be high. Will this be able to help the discipline? Will this be able to help the profession? Will this improve the quality of life of the people who are engaged or are stakeholders in the topic that you are pursuing? So this has to be argued in your proposal to make sure that you really are following the principle of beneficence. Next, we have maintaining an appropriate risk and benefit ratio. So, there are some research studies that are minimal or almost no risk. Like for example, collecting data or survey data in relation to, for example, preferences in what brand of toothpaste you are trying to take, or for example, your attitudes towards a specific, let's say, candidate in the election. So those types of surveys, they don't really present that big of a risk, however, there are certain topics that can cause increased risk or psychological harm. Like for example, when you are trying to ask for, let's say, sexual behaviors using surveys or interview, that is quite a very touchy subject and may increase the risk level. But and of course, there are also some studies that have super higher risks. Like for example, like I said, medicine trials or vaccine or clinical trials for drugs or nutritional supplements, they present larger forms of risks compared to social research. But what is really more important here, especially when the risk is unavoidable in a research, one, you have to make sure that the risk is deterred or lessened, or the chances of getting those risks or those harms are very much minimized. And number two, the risks that you are exposing the client to or the participant to must always be lesser compared to the benefits that they will get when they engage in the study and the benefits that the society will get from the research that you are doing. So that is the principle of beneficence. Make sure that participants or subjects are not harmed, make sure that the respondents are not exploited, make sure that the research that you're doing benefits the participant and society, and making sure that the there is minimized risk, and if there is a risk involved in the study, you have to make sure that the benefits outweigh those risks. So that's the risk-benefit ratio. So here are some of the potential benefits of that the participants can get when they join the study. Like for example, if this is an interventional study, then they have access to the intervention being tested. Like for example, it's a social program, or if it's an educational program, then they get access to whatever the benefits of that program being tested is giving. And for interviews, it could be the comfort of being able to discuss a situation or problem with an objective person like the researcher, increased knowledge about themselves or their conditions, having an opportunity to be able to introspect within themselves, because while they're answering, for example, a survey about their self-esteem or their attitudes, they'll be able to know more about themselves and have more self-reflection. But this type of benefit is seen more when you're doing an interview rather than a survey, because the survey is very impersonal. But it's of course what we usually do in quantitative research in social sciences or social studies. It could be an escape from the normal routine, excitement of being part of the study. Some people really find joy of being a part of a study, that they're being able to contribute to society by being participants in a research. So that's the same as the next bullet. And also, they could some research studies provide monetary or material gains through stipends or other incentives, no? And of course, the amount of the material gifts or tokens or money that you provide to your participant must be proportionate to what you're giving. Like for example, you cannot just be providing every person iPhones for the study that you're doing, and that is going to cause a lot of undue influence, no? But I've seen some, but for example, you have research that are surveys, and then they provide tokens to participants, like they provide free ball pen. So that's okay because that's a low stakes, no? But for larger research, like for example medical research, interventional research that has higher risks, no, their incentives must be bigger. Like for example, for those undergoing medical research, they have to have access to medical services, no? They have to have access to medications just in case they experience any form of side or adverse effects from whatever they are taking as a part of that research, no? Or for example, you're doing a full interview, then you have to provide money and food to the participant, because doing interview is quite tiring, so you have to provide them some refreshments, no? I also was able to look at another model of providing incentives, and that is through raffle, no? For example, they need a lot of participants in their sexual health study in the UK, and what I noticed in their survey is that they are offering, a brand new iPad, but not for everyone, but they're going to raffle that iPad. So I think that is a fair incentive. But if you're going to give one iPad for each person, then that's going to be problematic, because you're providing undue influence, and because they are not anymore joining because they voluntarily want to join and help. They are joining just because they want to get the gadget, no? But at least if it's a raffle, then there's a lesser probability that they are joining because of a specific gadget, no? So what is more important in the last bullet for the potential benefits is that whatever incentive you're providing to your participant, they have to be proportionate to what you're asking them to do. So, and sometimes there are certain research that do not really provide any monetary or token gains, no? Especially if it's just a simple survey that they have to answer online, then you don't really have to do so, no? And some risks that are found in the participants, of course, we have physical harm and discomfort, no? Psychological or emotional distress, especially when it's an interview and you're going to talk about really sensitive topics like death, sexual abuse, drug abuse, trauma. This can open up wounds, and you have to really make sure that before you engage in psychological research, you know someone, or there's someone in the team who is a psychologist, who is a trained psychologist, who can really handle this type of emotional distress, no? So this is one thing that you have to think about, no? For example, you want to look into the relationship between depression and sports outcomes, no? It's going to be quite difficult to convince the panel members or to convince the mentor or the ethics review that a student could really do a research measuring depression? Because what if they do measure that some of the participants have depression? You cannot just, turn the other cheek and walk away. It's not my fault. I'm just doing research and I measured depression. But what if there is depression? It is the accountability or the responsibility of the researcher to be able to provide the help needed by the participant when we find out that that person has depression. So we cannot just walk away and say, I'm just doing research. I don't have to treat the depression. No, you have to at least refer the person to a counselor or a psychologist who can, but of course another issue there is privacy, and I'm already talking about other principles, but yeah, privacy. Does the person want to be identified as depression, and do they really give you the right to provide their details to a psychologist or a counselor? So these are some of the tricky slopes that you have to think about when you're designing research, especially when you're measuring psychological concepts or variables. And then, of course, we also talk about social risks, such as risk for stigma, adverse effects on personal relationships, or loss of status. Like, for example, if you want to do research on people with drug addiction, or people who are victims of sexual abuse, people with certain diseases that are socially stigmatic, like, for example, HIV or sexually transmitted infections, there is a risk for embarrassment, there's a risk for shaming if their data gets leaked out. So you also have to look into that. So it can also, another risk, is loss of privacy. Minor risks like loss of time, So, of course, when you do interviews, that will take at least an hour of the time of the participant. If you're doing a survey, that will take at least 5 to 10 minutes of the participants. 5 to 10, not so many, but still time taken away from the participant. And of course, the monetary costs that the participant has to go. So the main goal here is that for any monetary expenses that is incurred by the participant or the respondent, for them to be able to join your study, like for example, if you want to do internet interview, they have to pay for their internet connection. You have to compensate that. If you're doing a face-to-face interview and they had to ride or to commute from point A to point B where you are going to be interviewing them, you also have to pay them whatever they paid for commuting. You also have to provide them with food, etc., etc. So, again, what is important in relation to, to benefits and risks of your research is that, one, you have to be able to put in your proposal, in your protocol, all of the potential benefits honestly, known and honest benefits of the research to the participants and society. You also have to honestly and correctly identify the risks that are found in the study that you are going to do, and at the same time argue that the benefits that you are going to provide the participants largely outweigh the risks, if there are at all any risks that are found in the study. So these are the important things that you can remember, that you must remember for creating your proposal. So the second principle in the Belmont Report is the principle of respect for human dignity. So under this principle is the protection of the participants' right to self-determination, meaning they should be voluntarily be able to decide for themselves whether or not they're going to be part of the study, and there should be absence of coercion. Wala dapat pamimili or walang undue influence for the research participants to join your study. So for example, you cannot bribe the participants to be part of your study. You cannot force them to be part of the study. You cannot bully participants to be part of the study. You cannot pay participants using large amounts or luxurious gadgets for them to be part of your study. They have to decide on this voluntarily, and it's not just voluntarily. They have to be providing an informed decision. Like for example, you cannot just say, "Do you want it or not?" without telling them what they are going to be expecting. You cannot just ask them, do you want to be a part of it or not, without telling them what are the negative aspects of your study and also the positive aspects of your study. You're going to tell them that truthfully, you're not going to deceive them as a part of the study, etc., etc. So you have to tell them the whole procedure. You have to tell them all of the risks if there are risks. You have to tell them all of the benefits. You have to tell them all of the interventions that you're going to do as a part of the study. You're also going to tell them about their rights, about the participant, about the research. You're also going to tell them about where their data will go, how their data will be handled, how their data will be stored, and what is the extent of their access to their own data. Can they withdraw from the study? Which, spoiler alert, yes, they can. Self-determination includes, being a part of the study and also having the free will to be able to leave the study anytime, and they should not be losing their benefits from it. So all of these things, risks, benefits, procedures, requirements, duration of the study must be fully disclosed to the participant prior to them making a decision. So remember that the decision must be done when the participant already has a good amount of information and knowledge about the study that you want to conduct, that you are inviting them in. So there should be absence of deception and concealment. However, in certain studies wherein deception and concealment is important, like for example, time and motion studies, you can request that from your panel or your ethics clearance, that you can hide some of the information because it will affect the actual outcome of the study. But this is only when, one, it is really an essential part of the study, that there will be a big problem in the rigor of the study if this was not done. And number two, that the deception or concealment that is going to be done is not going to be causing large harm on the participant. But more importantly, one, kailangan ba talaga na hindi sabihin? But in most of the research that you will be doing under the sports studies or in the sports sciences, most of the time you really are required to have full disclosure of all of the aspects of the study before you ask the participant or the survey respondent to join your study. And the third principle under the Belmont Report is the principle of justice or fairness. So there should be right to fair treatment. So random selection of participants is encouraged. If we can do random selection, then it would be better. But there are times where in random selection cannot be done. But also in relation to fair treatment, you also have to look into whatever risks the participants are going to be exposed to. You have to always compensate them. You always have to be ready to address those risks. So if there are physical risks, then you have to provide medical assistance if the risks become reality. If there are if there are psychological risks, then there should be a psychologist in the team, or there should be a psychologist that needs to be present during the interview, or there should be someone you can refer them to for treatment. If there is a monetary expense for the participant, you have to compensate for whatever the participant expended or spent, so that they can be part of the study. So fair treatment. When you're doing interventional research, some research will be some participants will be assigned to the intervention, and some people will be assigned to the placebo. Like for example, in vaccine trials, for instance, some people receive the actual vaccine in the experiment. Some of them they just receive water, and they're going to compare the participant. So the chances for each participant to be part of either group must be fair, must be randomized. But in social research, there's not much issue in relation to this, because placebo or a false treatment is not present in most social research experiments. We'll discuss that later. But those are some of the principles or interventions found in the fair treatment clause. And also, very important is the right to privacy. That all the data will be protected by the participant, that there is anonymity. You don't collect personal or private data from the participant if it's not needed. So, you don't collect the name of the participant, the address of the participant, the cell phone number of the participant, especially when it's not an essential variable in your study. And then confidentiality means that when the study is out, they should not be able to connect the findings or specific raw data to the participant, to a certain participant, to a certain identity of the participant. So it has to be protected. The data has to be stored in a safe place, and there should only be a limited number of people who have access to their own data, to the data. So it should be the research team, and some of the assistants within the research team, probably the consultants of the research, the mentors of the research will have access to the data, but other people should not have access to the data. Those who are not part of the stakeholders in the research should not have access to it. Can the participants have access to the data? The answer is yes, but only to the data that they provided. So for example, the only data that participant A can access from the researcher is only the data of participant A. They cannot get the data of participant B. So that confidentiality. So especially in the day and age that we mostly collect our data online, it's so important to encrypt all of the data storages that we put. So if we put our data in the cloud, we put our data in the Google Docs, we have to make sure that it's encrypted. We have to make sure that the sharing function of the data, of the documents and all the Excel files must be limited to those who are only are related to the research project itself. So you cannot just have it exposed to everyone for them to access. So these are the components of the principles of justice. Now we have here specific elements of research ethics according to the Philippine Health Research Ethics Board, which published the National Ethical Guidelines for Health and Health-Related Research in 2017. So this is also applied to research studies that are not related to health but are engaging human subjects and data coming from human subjects. So the first element is social value. So what do they mean by that? It's important that the researcher is able to argue in the proposal or in the protocol why this topic or why this specific research study needs to be done. And there should be benefits that the society, the community, or the profession or the people will get from the findings that you will get eventually from the study. Next, of course, is informed consent. So I explained this earlier. This is related to the self-determination, the right to self-determination, and the ability to allow the participants to make voluntary choices that are informed prior to their recruitment in the research study. Next, we also have to consider the vulnerability of research participants. So there are certain research participants that have characteristics that make them more vulnerable, meaning they are exposed to more risks and are exposed to more risks for exploitation when they are joining the research. So example of vulnerable research participants are, let's say, minors, those whose age is below 18, the very old, those whose age is beyond 60, those who have diseases, those who have chronic illnesses, like for example tuberculosis, and those who have stigmatic characteristics, like for example people using prohibited substances, studies on for example commercial sex work, or those who are involved in petty crime. So these are all considered vulnerable participants because they have characteristics that already place them at more risk compared to a normal healthy adult. Next, we have also the identification and minimization of risks, identification and maximization of benefits, and of course, the safety measures that the study will undertake. Next is also the indication or the articulation of the procedures that the researchers will undertake in order to maintain the privacy and confidentiality of the information to be collected in the study. So I explained this earlier. This has to be anonymized, that it should be stored in a secure location, etc., etc. Next is justice in relation to fair treatment among participants, proper compensation for any expense that the participants will incur when partaking in the research. And finally, transparency. So it is required for the researchers to be honest and objective about their findings in the research, that there should be no malicious intent when they are doing their research, that they will not modify or contaminate the data in order for them to be able to get positive results. Also, disseminating the results to the important people that are that may need the findings in the results, etc., etc. So probably common in health and social research, that involves human participants is the securing of the informed consent. So when we say that the participant or respondent or subject has given informed consent, it means that one, the participant should have had adequate information about the research. It means that you have given them a document or you have given them an orientation that tells them about all the procedures of the research, including the duration, including the intervention, including the data collection methods, including their expected participation as respondents or subjects, including the responsibilities of the researchers and the rights of the participants, including the contact details of the participants and the contact details of the institution, specifically the ethics review committee, including also the risks and benefits of the study, what are their expected compensation, what are the expected benefits. So it means that the researcher has to have given a thorough explanation to the research, either through oral or written method, or both. More important, it's actually better to have both, written and oral. But of course, sometimes you can only have written or you can only have oral based on the type of research that you are doing. And then also, aside from giving them the information about your study for them to be able to give a sane decision whether or not they want to be a part of the study, you have to make sure that they comprehend that information. That's the reason why, when you make the informed consent such as this one, you have to make sure that the language that you are using is understandable. It should be laymanized. There should be no jargons or highly scientific terms in the informed consent, so that you are sure that the research participant or respondent understands the study. Sometimes when we are getting data from community people or people from poorer communities, we actually transform the informed consent to Tagalog or the vernacular language to make sure that the participants really understand the informed consent. And then after them being able to be given the information and being able to comprehend that information, informed consent form, when they sign this, for example, they sign this participant. When they signed it, it means that they are giving you a free choice in deciding whether to participate or withdraw from the study. They say they have a freedom to say yes, they have a freedom to say no. And when they sign, it means that they are voluntarily subjecting themselves in the research. But remember, not because they already signed the informed consent in the beginning, it doesn't mean that they are beholden to you to finish the whole research. There's always a caveat in research that anytime that they want to withdraw themselves from finishing the study, regardless of signing the informed consent, they are free to withdraw from the study anytime, even if they already provided a prior consent. So as I explained earlier, all social research require informed consent from human participants age 18 or older. But what if you need to get data from participants who are 17 years old and below? If we have to get it from 17 years old below, we have to also do assent form, no? Assent form minor. So an assent form, no, or an securing assent process is similar to the informed consent securing process, but it's just that the form should be, of course, the language and the understanding should be tailored on the age. Of course, when the participant is younger, then the type of language or the type of the way we do the consent would be different. However, for minors, no, for minor respondents or minor age respondents, you need to, in order for the participant to be a part of the study, they need to the minor participant needs to sign a minor assent, and at the same time, their parents or their guardians must sign, no, a parental consent as well. So there are two consent forms that has to be signed. One is an assent form that must be signed by the minor, and the second one is a consent form to be signed by the parent. Now, you can only have double or nothing. If either one is missing, then the research respondent cannot be recruited for the study. But generally, what is common among informed consent forms or informed consent documents are the following information. So one, there should be a statement that this research is a project. That this project is a research, no? That you are being invited for a research study. Who are you? You introduce yourself, from what institution are you coming from, and that the research participation is voluntary, and also explaining why they are being invited. No, explain the characteristics of your potential respondents and why they fit that specific characteristic. Number two, you also provide them a summary of the proposal or the research protocol, including the purpose of the research. So you have a section on why this study is needed and relevant. You give a section on what are the objectives of the study. You also provide them the duration of the study and also the expected time that they are to allot as respondents to be part of the study. So you say, this will take you around 5 to 10 minutes to finish the survey. Or for example, this is an experimental research where you have an intervention. We expect you to attend 5 seminar sessions in a span of 5 months. So you have to tell them how long is their expected engagement in the research. Next, we have the list of procedures that they will go to. So are they going to do a survey? Are you going to take a survey? Are they going to be interviewed? Are they going to be observed? Or what type of interview is this? Is this going to be a discussion with a group, or is this going to be a Zoom meeting or a Google Meets meeting? Is this going to be a face-to-face meeting? Etc., etc. If this is an interventional or an experimental research, you explain them the intervention. You're going to be attending a session, or for example, this is an exercise science research. There's an intervention. For example, you have to engage in this type of modified exercise, and you're going to be measured your heart rate, or you're going to be measured your flexibility, etc., etc. But you have to tell them all of their expected engagement and the time that they are expected to engage in those activities while they are a part of your research. And as I mentioned earlier, the informed consent form should already include reasonable, foreseeable risks and discomforts of being a part of the study. So is this going to be is this going to take much of their time? Is this going to have social risks? Is this going to have some sort of physical risk? You have to explain this. And also, at the same time, while you are explaining the risk, you also have to explain the researcher's responsibility just in case something happens to the participant, so that the participant knows whether or not the researcher is going to be responsible or going to take care of the participant just in case something happens to them. And then number 4 is the reasonable and expected benefits of the researcher. Siyempre, you already presented the risk, you also present the benefits. What are they going to get? Are they going to get any benefits? Are they going to get incentives? Are they going to be paid for their internet connection? Are they going to be paid for food, commuters fees, etc., etc. And then, of course, explain to them whether or not this is going to benefit the profession, the community, or the group they are belonging to. And also, explain if this is an experimental research, explain if there are alternative treatments or procedures that is similar to the one that you're experimenting on that they can consider. So what are the other concerns that are specific to social research? So of course, coercion. No, there should be no form of coercion that should be seen in the research. You cannot bully your participant to be a part of the study. You cannot pay them a hefty amount of money. It should just be proportionate to the amount that they are expected to, the expenses that they incur. No. And then, of course, there's extra care for people who are considered as indigenous peoples because there is an extra layer of permission that you have to get. So you just don't get individual consent. You may need to get community consent from the tribal elders, and you may also you also need to get permission from the National Council for Indigenous People of the whatever regional office is found where the tribal people where the tribe you want to research is found, no? And then you also have to take note of vulnerable population and make sure that you have more protective measures in place in your proposal. And who are the vulnerable population? So as I explained earlier, children, because they are not yet of age to be able to have that mental capacity to decide for themselves. That's the reason why you have to get their assent and their parental consent. Older people, because they have certain conditions that put them at higher risk for the different types of harms. And then, of course, prisoners are considered vulnerable because it's harder for them to make decisions for themselves, and what they could say could also put them in legal implications, etc. And also other institutionalized people like nuns, priests, and the military people, because they belong to an institution wherein their obedience is a requirement. So the voluntariness of deciding to be a part of the research may be dampened, no, because they might be coerced to be a part of the research of the one who's their superior, no. And then, of course, people with mental and health conditions, no. So if the participant has a health condition, then the participant has the researcher, must provide extra safeguards to this participant, like for example, providing access for medical care. If this is a psychological concern, then there should be psychological care that must be available for the participant. Next is, of course, pregnant women, because you only include pregnant women in the research if it's about pregnancy. So, but if it's not about pregnancy, you don't include them because, again, their condition is more sensitive compared to non-pregnant counterparts. And also, you can include in the vulnerable population are those people with certain social stigmatic characteristic, like commercial sex workers, drug users, people living with HIV, people with leprosy, people with disabilities, or PWDs are also included here because, again, they are of higher risk for different types of harm. And also, when you do any form of community research, you don't only just get individual consent, but you also get a community consent. No, you have to gain acceptance from whoever is the leader of this given community. In social research, you also have to identify the different risks that might be found in the study. For example, there could be physical risks that are found in research, like for example, fatigue. Probably you need for them to answer a lot of questionnaires, and that will take them 1 hour, so that will give them some sort of fatigue. So provide them. So it's you can see here in the table that if you identify a risk, you also have to identify what are the safeguards that the researcher will do when this risk becomes apparent to the participant while the person is engaged in your research. So example of a social risk is stigma. So what to do, what to do in order to what to address the stigma. Psychological risks, for example, emotional distress. Legal risks, like for example, disclosure of illegal drug use, or economic risk, like for example, loss of job, or advancement, or they might need to pay something in order to get to you. For example, they need to ride, they need to commute, or they have to take an Uber or Grab in order to get to you. You have to pay for that. So that is what's really important. When you are trying to make an ethical protocol, you have to identify and be honest with all of this risk. Present this to your participants and make sure that you have strategies to be able to address these risks just in case they happen. And also, you have to explain to them the probability. Be honest. Like for example, if it's just a survey, then it's safe to say that there are no physical risks involved because it's just a 15-minute survey. You will not get any physical harm from that. So it's really just looking at your procedures, trying to predict or trying to foresee what possible risks that the participants or the respondents can have while being engaged in those procedures, and making sure that for whatever risk you identify, the researcher has set up strategies in order to address these risks. And finally, what are specific rules in terms of online research? So, of course, you have to be very clear about the recruitment because, of course, in the recruitment, you have to make sure that you are recruiting the right persons, and also the recruitment should not identify the persons while you are recruiting them. So you have to be very private in the way you're handling the data for recruitment. And then, of course, I explained to you earlier that even if it's online, you still need to secure their informed consent, and you can use an online informed consent form, and you can use the buttons in the Google form to be able to allow them to decide yes or no. And then when they say yes, they proceed to the next questionnaire. If they say no, then they cannot proceed to the next part of the questionnaire and move to the end. You have to make sure that if you're using secondary data, you're already using, for example, you're analyzing tweets, you have to make sure that the names of the owners of the tweets must be de-identified. But at the same time, you also have to make sure that you are collecting the tweets from the correct participant. Looking at how Twitter is nowadays, there are a lot of accounts which have an unverifiable identity, those accounts that are made only for fun, as a stan account, or for example, as a troll account. So, is this the focus of your research? Or are you focusing on research that really represents an individual behind it? So, you have to be very careful in terms of collecting tweets from specific accounts. You have to always go back to what are the parameters or the characteristics that you need for your study. Of course, it would be different in terms of ethical consideration when you're collecting primary or secondary data. If it's primary, then you would need informed consent to be able to obtain the data. Because remember, you're just using the internet in order for you to collect the data as they give it to you. But for secondary data, examples of research is, for example, you want to check out the blog posts of a certain sports personality, or you want to look into Twitter posts, or you want to look into Facebook posts that are already posted. So you did not collect this data. Instead, this data is already present in the social media, and you are just going to mine it for analysis. Now, these are secondary data. Now, the next question is, when do you know that you are allowed to mine a data? So the question is answered by the basic or to answer that question, you have to identify whether or not that data is public or private. So how do you know that a data in online is public? It is public when, in order for you to access that data, you don't have to put in a password or you don't have to have a membership. If a membership, or you don't have to follow that account. If you have to follow that account in order for you to see the tweets or the Facebook posts, then that post is considered private. If it's private, you need informed consent. If it's public, then you don't need informed consent. You only need informed consent for public data when you need to post a specific tweet as in an exemplar for your research. For example, you have a finding already and you want to demonstrate your finding by giving an example of a tweet. Whatever tweet you have chosen, you have to message that person and ask whether or not you could use that specific tweet for your write-up. So that is for basics of online research. So in this video lecture, we were able to learn about a short history of the codes of ethics in research. We learned about the Belmont Report ethical principles. We talked about the principles that are related to the PHREB in the Philippines. We also talked about the ethical principles of collecting informed consent, making informed consent, and securing informed consent from the participants, whether that's online or through paper. We also discussed about the different components of the informed consent form, and we discussed about specific concerns in social research and internet research.